Hi, my name is Stacey Simmonds, and some of you may know me as the Events Director at the Ehlers-Danlos Society. Working for the Society is especially close to my heart, as like so many of our members of staff, I have Ehlers-Danlos syndrome. Today, I would like to share my journey and experiences with you, focusing on my bladder pain. This is me around age 3, when my first symptoms of EDS began, although I was not diagnosed until 23 years later. I am pictured here with my older sister, who also has hypermobile Ehlers-Danlos syndrome. On the right of the slide is an excerpt from my 1993 school report when I was 9. It makes me smile as it sounds exactly like me now, although little did I know then that my poor coordination could have been one of the earliest telltale signs of the start of my EDS journey. It reads, "Physical development and education is not one of Stacey's favourite subjects. She gamely attempts everything, but is not the most agile, well-coordinated or athletic member of the class. She is quite philosophical and good-humoured about her lack of ability in this area." I kind of love that my teacher referred to 9-year-old me as philosophical. In the centre of the slide is a photo of my bedroom as a teenager. I was obsessed with zebras, but I had no idea of the connection this would lead to in my adult life. As a toddler, although I do not remember, my parents and GP records tell me I had very frequent UTIs, urinary tract infections. The doctors were baffled as to why this was happening to such a young infant, so I was referred to Great Ormond Street Hospital in London for invasive testing, including a urodynamic study. The results were inconclusive and left the professionals confused why the muscles in my bladder and urethra were functioning so poorly. Throughout my childhood and teenage years, I can remember more often than not being on antibiotics for a UTI. I was aware that my frequency and urgency were interrupting everyday life, but I didn't necessarily know this was outside of the norm. When I was 18, I began getting episodes of severe abdominal pain, where I often ended up in the emergency room. The doctors decided to do a laparoscopy to check for the cause of my pain, and it was after this moment my health truly began to decline, like so many other EDS patients report have happened to them after a traumatic incident. When they inserted the laparoscope, my large bowel was perforated. This resulted in emergency open surgery, a 3-week stay in ICU, battling with sepsis, kidney failure, and pneumonia. Despite the traumatic circumstances, I pulled through, and the doctors were still able to diagnose the cause of the abdominal pain as polycystic ovaries and interstitial cystitis. At the time, the surgeon also reported his confusion at the length of my bowel and the position it was in. He likened it to an 80-year-old woman's. Since being diagnosed with EDS, I have been told this could have been an internal flag that something wasn't quite right with my tissues. After recovering from the impact of my first major surgery and regaining my kidney function and strength, my general health declined and I began collecting a list of diagnoses. My UTIs became even more frequent, and I was referred by my GP for another urodynamic study. The diagnosis this time was Fowler's syndrome. Whilst I was grateful to have an answer to my years of bladder issues, there was little research and understanding about the implications of this syndrome, and back then, 15 years ago, it wasn't so easy to Google the answers. I was referred to the team at the National Hospital for Neurology and Neurosurgery in London under Professor Claire Fowler. Their further testing confirmed the diagnosis of Fowler syndrome, which is a cause of urinary retention. I was placed on a long waiting list to try a neurostimulator, and eventually I had one fitted, but the team couldn't understand why they couldn't get the implant to sit in place under the skin beside my spine. They eventually had to do several surgical revisions and literally sew the device in place to my spine. Quite an ordeal, and sadly, I didn't find any benefit from the stimulator. The team also placed me on a double-blind trial of Viagra. Yes, Viagra. But sadly, that was also unsuccessful. Soon the puzzle pieces began to come together. Alongside my ongoing bladder issues, I was also developing disabling autonomic symptoms. As my sister had similar issues, it was recommended I get tested for POTS. I then went on to be diagnosed with POTS after a tilt table test with an average resting heart rate of 140. I ended up on a cocktail of drugs to try to control the POTS, including midodrine and octreotide, which I had to self-inject after every meal. I was also simultaneously referred to a doctor in London who diagnosed me with HEADS with a Baton score of 8 out of 9. He then referred me on to a urogynecologist in London who specialises in bladder problems with hypermobile Ehlers-Danlos syndrome. The urogynecologist did further extensive testing, and a cystoscopy showed severe damage, inflammation, and infection deep in the bladder walls. Biopsies also showed a very elevated mast cell count, and a diamine oxidase blood test showed I am histamine intolerant. I went through several rounds of different cocktails of antibiotics, but the UTIs kept returning. I was prescribed every pain medication under the sun, but nothing really took the edge off the pain when it was at its worst. We tried a different avenue to combat the pain, a course of DMSO, which are bladder instillations of dimethyl sulfoxide into the bladder. It's believed that this solution works by increasing bladder capacity and relaxing pelvic and bladder muscles. It also passes through the tissues in the bladder wall to help reduce inflammation and discomfort. This treatment did the opposite for me and was quite traumatic. The aim is to hold the solution in your bladder for 30 minutes or more, but the pain was so severe I could only manage a couple of minutes, after which time I was rolling around on the floor in severe pain. It felt like the solution was burning holes in my bladder, and the sensation lasted for hours or days afterwards. Another failed treatment. Due to the mast cell issues, I was then referred to an immunologist who did extensive testing, including around 50 blood tests and urine samples, which had to be shipped overseas to be tested. I was then officially diagnosed with mast cell activation syndrome, which explained the years of allergic reactions I had been having from everything from sunlight, food and drink, and multiple medications. I was then prescribed a mast cell stabilizer and long-term high-strength antihistamines, as well as rotational antibiotics, and I was advised to try my best to stick to the recommended low histamine diet. At the peak of my bladder problems, when my normal residuals were around 300 to 500 ml, it was recommended I learn intermittent self-catheterization. This was extremely daunting at first, but I was encouraged that despite my reluctance and fear, it could give me a new lease of life. A very patient team of nurses taught me the technique and introduced me to a new world I never knew I would be so grateful to discover. These are a sample of catheters I have been using for the past 10 years. I self-catheterize up to 10 times a day. There isn't a one size or shape fits all when it comes to self-catheterization. You will need to try a few until you find what's right for you. Like some people have a pair of shoes for every occasion, I should probably disclose I have those too. I like to think I have a catheter for every situation. There's something for everyone, male and female. My daily go-to is the SpeediCath Compact, which is in the picture 1 and 2 here. Even when I don't carry a purse or a handbag, you'll find 1 or 2 of these in my pocket. Note how discreet and small they are, similar to a thin lipstick. When I was pregnant with my son, I preferred the longer length SpeediCath in number 3 here. And that's because mainly the access to the area down below was more of a challenge with a huge bowling ball in the way. The next one along is the Infiner Chic, which has a really comfortable grip, though I don't find it empties as well as the SpeediCath. The next 2 are super smart hybrid catheters with a built-in bag for easy disposal. The Vape Pro Plus Pocket on the far right is my newest recommendation from my team, designed for people with frequent UTIs. Unlike many catheters, this catheter can be gripped anywhere along the protective sleeve, and it has a built-in tip which helps shield the sterile catheter during the insertion and removal from bacteria. The Actrine is also a great option for emergency situations when you can't locate a toilet, as the attached bag collects the urine, which you can then dispose of later. Depending on how severe my pain is each day, I might choose a size 10 instead of my usual size 12, which refers to the thickness of the catheter. The 12s are generally better for me as the flow is stronger, so it's a quicker process, but sometimes the 10s are all my angry urethra can handle. I love to go camping with my family, so in those can't get to a bathroom quick enough situations, the catheters with a bag attached are ideal as they can catch the urine. Don't think self-catheterization means you need to restrict the activities you love or usually do. I have catheterized everywhere and anywhere, from a rainforest, beach, peak of a mountain, plane, train, and automobile. My catheter supplier in the UK is amazing, as well as offering a wide range of products and accessories. They've got an amazing support team of nurses too. This really is my flare face. My bladder pain can be overwhelming, all-consuming, gut-wrenching, heartbreaking, and unfair. I am in pain every single day. If you ask me on a good day, it might be a 4, on an average day a 7, on a 10,000 swords and a bonfire are attacking me, a 13. This is an accurate descriptive image of one of those days. Like most EDS patients, bladder pain isn't the only pain I suffer from. Since my major surgery for the bowel perforation, there have been more surgeries to correct complete bowel obstructions, one of which followed a long episode of gastroparesis where I was TPN fed for a month. I also frequently suffer with partial bowel obstructions, which cause me debilitating pain, as well as many painful gynecology issues, including adenomyosis, ovarian cysts, and fibroids. Though I count myself lucky to not suffer with as many joint issues as so many I see, aside from frequent sciatica, back pain, and migraines, my joints, in the most part, behave themselves. Maintaining relationships with a chronic condition is challenging. Good friends know that if they want to make a plan with me, we will have to pencil it in rather than pen it in. There is no telling when a flare or severe UTI will hit, and on my very worst days, I can't even manage to climb the stairs in my house, something I am sure rings true to so many of you. Those who know me will be very familiar with my brave face. I have become an expert at masking my pain with a big smile and a positive attitude. It's quite honestly one of the most effective natural pain relievers I've tried. My whole life has revolved around finding the nearest toilet. My frequency and urgency is so severe that the normal frequency for me is every 15 to 30 minutes, and I get up to use the toilet anywhere between 2 and 10 times a night. I have so many recurring dreams where I am desperately searching for a toilet, and I either cannot find one, or when I do, I get stage fright as the toilet cubicle has no door. Talk about my anxieties playing tricks on me. Something I never thought I would need to worry about is the opposite of the urinary symptoms I've lived with all my life, incontinence. I have never used to have problems with this, leaking or accidents of this type, as my issues were all related to retention and not being able to pee at all. But a couple of years ago, to try and find an answer to these new symptoms, at age 36, I had my third urodynamic study. This showed that my bladder was severely prolapsed, and it also gave my very fed up bladder a new name, atonic. This meant the muscles in my bladder no longer functioned whatsoever. Since then, dramatic urine leaking accidents are as common to me as dramatic retention incidents. Most commonly, these occur when I have a UTI. In fact, they are usually my first warning sign that I need to get a urine sample to my GP for testing. My grateful underwear has found a new best friend in incontinence pads, which are a godsend when I'm having a serious flare and need to quickly go out on the school run. And they also give me the confidence to go out for longer periods of time and feel protected. The other image in this slide is the Just Can't Wait card, which you can get for free from the Bladder and Bowel Foundation. I recommend this to anyone who panics about being able to explain yourself in those urgent, I need the toilet now situations. They've also just introduced this digital version, which you can upload to your phone. So what have I tried, or what am I in the process of trying now? Every one of the things on this page and more. Many of you may be nodding in acknowledgement at several of these familiar sites. And if you've tuned into this late, you might be extremely confused by the Viagra image. In all honesty, no pharmacological medicine has really ever helped my ongoing pain and infections. I have a laundry list of drug allergies, so there is very little left to treat me for with a UTI. On average, I suffer with one every month and a severe complicated one every 3 months. The latter usually gets treated by IV gentamicin antibiotics on an outpatient basis, but in recent months I have been prescribed gentamicin instillations, which I administer myself through self-catheterization at home. Not only is this much more convenient, but I have seen a glimmer of hope that this is one of the very few treatments which has worked for me. I am currently midway through a new batch of treatment, Uriel, I'm still not sure how to pronounce it, installations, which I have administered at my local hospital by nurses every week. Once these are completed, they will begin a trial of tibial nerve stimulation, where the nerve in my foot will be stimulated to try and help me with the urgency and frequency symptoms. I hope that in 6 months' time, I'll be able to say that one or both of these has helped. But whichever way, as you can tell, I'm up for trying anything. Ultimately, there is no magic pill or miracle treatment. There is only one thing I can confidently say that has worked for me and my painful bladder: acceptance. It can be so easy to become despondent when living with a chronic illness and knowing there is little to no light at the end of the tunnel. I spent so many years searching for answers and looking for new opinions and options on what might work until I came to the realization that this condition was as much a part of me as my right arm. I'm stuck with it, so I'm going to need to make friends with it. Let it know I accept it and take control of my destiny. I now accept that the pain I feel today will make me that little bit stronger tomorrow. Many of you may not be as fortunate as I am to be surrounded by so many supportive family members, friends, medical professionals, and colleagues. I thank them all from the bottom of my heart for their patience, kindness on the good days, the terrible days, and everything in between days. I have the unique pleasure of working with some of these medical professionals every day. I want you to know that they are listening. They do believe you. They can spell it, most of them, and they are working so hard to improve our lives. To those of you who aren't as lucky as me to live in a big city with an incredible NHS system and relatively easy access to care, on behalf of the Society, I want to tell you that we see you all, and our mission is to reach you in any way we can, including through the magic of technology to bring you this amazing virtual event. Our mission is to educate your medical professionals and community members to know more and do more for you all. Thank you so much for listening. If you have any questions or want to find out more about anything I've discussed, my inbox is open to you and my email address is on this slide. I do hope you'll join me for the live Q&A coming up next, but I won't hold it against you if, just like me, you need to run to the toilet first.